everybody, Suzanne Conversing with Donnie Vision's Hypnosis. Here's a question for you. Do you know which patients you truly enjoy working with? Because it is my belief that we all have our favorites. Some people really love working with kids, young kids. Some people really like working with teens and college-aged kids. Not as many from my experience, sadly. I actually love working with that age group, or those two age groups. Some people like working with more mature people. Some like men, some like women. And then it breaks down in terms of the various mental health issues that anyone might come on with you to heal. So who are your favorite people? Because if you're in practice on your own, it will greatly benefit you to be able to market to those people. Those people will know that you're talking to them when you actually say that you're an expert working with women who are dealing with anxiety issues from the ages of 35 to 55, feeling overwhelmed, especially in the workplace or something like that. It really helps people to understand that you're their professional. It makes the marketing so much easier. Too many people want to say that they do anything and everything, and we know that if we've worked in the field for a while, that we can deal with pretty much anything. And I'll give you an example of something that happened to me a lot of years ago now, actually. I had put out some flyers for smoking cessation, and one of the flyers happened to be in one of the hallways of Harvard University. There was a young 29-year-old woman who was actually going to school there at the time. She saw the smoking cessation flyer, or it was actually a brochure, and she realized that, she had compulsive behaviors, just like smoking is. But in her case, it was based on eating disorders. Anorexia, which was pretty under control in terms of her weight. She had a beautiful bikini body, 5'9". So that was not the issue, the weight, which made it easier for me to work with because I really don't work with people with anorexia who are not healthy in their weight. I deal with them in terms of the thinking processes that are causing the problems, boundary issues, and those kinds of things. So people are smart, they'll be able to ask you if you work in areas other than what you have marketed for, but you do want to simplify your marketing. It's just an idea for you because you don't want to make your life difficult. You want to make your life easy, right? And if you do a really good job with the folks that you're working with in that particular market, you'll get referrals. And that's what happens with me. I have a client who has sent me several referrals based on situation that she had to contend with. I've had other ones do similarly with different areas of expertise because over the time period that you work in this business, you realize that different types of clients come in at different times. Like when I first began, most of my clients were coming in who are either underemployed or overemployed and didn't want to have to deal with all the responsibility that they had in these really high-paying jobs anymore, but their families were really used to that huge income and they're feeling really perplexed about how to contend with that. Later on was when the anorexics and the bulimics started coming to see me and the sex addicts as well, all around the same time. And then after that, it was a bunch of college students who were dealing with anxiety that was getting in their way. So over a period of time, different people will show up for different things. But if we have an understanding of who we truly enjoy working with, market to those people. Seriously, do that. I was actually lucky with an anorexic who came in to see me. She's not anorexic anymore, thank God. She's doing really, really well, even all these years later. Because I really don't enjoy doing smoking cessation, not really. One of my mentees does a wonderful job at smoking cessation, but for me, I prefer to work with more challenging cases where we really have to dive into the deeper issues of what caused the problem, why they're holding on to it, and how to help them to live into their compelling future. A lot more interesting work. They don't tend to make excuses. They're sick of being sick of being stuck, and they want to do the work. And that's a beautiful thing. So figure it out, folks. It'll make your life a whole hell of a lot easier. If you're interested in learning how to integrate hypnotism and neuro-linguistic programming into your healing protocol, this is one of my missions in life. I really want you folks to learn how to work with the subconscious mind, because you don't learn that in conventional therapy school. Not in the least. Not the way we hypnotists and neuro-linguistic programmers understand how it works, because that's really where the transformation needs to happen if you're actually going to help people heal, not just manage symptoms, but actually help them heal. That is the bottom line of everything that I do in my practice, and I'd love to share with you how to go about doing that. If you're interested in learning how to do this, it's a 2-day one-on-one, totally done online VIP program with 12 months of mentorship, so you can learn how to integrate it into your practice. So if you have questions with regard to a patient that you don't really know how to move forward with, you just message me and we set up a video call and I tell you exactly what you have to do. My trainees love this program, and you're going to find that you'll be able to help a whole lot more people and charge a lot more for what you're doing, because people will pay to save time. They don't want to be sick. They want to be well, and they'll pay for it. Well, that's all I have for you for this one. As always, I thank you for spending your time with me. Till next time. Bye-bye all.